In this afternoon's Health Alert, a new trend being dubbed Ozempic babies. Women who are using injectable weight loss drugs like Ozempic, Wegovy, and Zepbound are reporting surprise pregnancy. Some say they're getting pregnant despite being on birth control. Others say they have dealt with infertility for years. Now, we want to be clear, these are anecdotal reports. The FDA says they are unaware of data that shows an increase in unintended pregnancies and these medications, but these medications do come with warning labels that oral birth control may not work as effectively.
Well, that could be a good thing or a bad thing. Joining us now is ABC News Chief Medical Correspondent Dr. Jen Ashton. No one better to talk about this because you're an expert in obesity, and you're also an OB/GYN, degree in nutrition. You're the perfect person. What is going on here?
Okay, well, a lot of things. So I'm glad we're talking about it. First of all, we have to remember that if you take the GLP-1 agonist class of medication like semaglutide out of the equation, women on, let's say, oral contraceptives have a typical failure rate of 7% at baseline. Then when you look at women who are overweight or obese, they have higher contraceptive failure rates than women of normal weight. So that's a second factor. Then you put in this class of medication, and part of the way it works is it slows the emptying of your stomach. So it could make oral birth control pills less effective. There's failure rates with all types of contraceptive methods. And then we have a saying in reproductive health in OB/GYN, at the extremes of weight, both women who are significantly overweight and women who are significantly underweight, if they get their weight to a normal range, their ability to conceive absolutely improves. So I think we could be seeing a number of factors at play here, but the most important one, and Liz, you said it in the introduction, is that this class of medication is not approved for use in pregnancy. So I think that's why a lot of women are being caught off guard and concerned if they find themselves with an unintended pregnancy.
So then what do those women do then?
Well, if they're taking these medications for weight loss, they should obviously discontinue that, speak to their OB/GYN. A lot of OB/GYNs are being proactive, recommending that their patients take these medications to lose weight before pregnancy, because we know that pregnancies in women who are obese or overweight are much higher risk pregnancies. So it's the right intention, but apparently, not everything follows a manual. So
there's nothing in the drug per se that makes anyone more fertile, correct?
That is correct. Yeah.
Right. It's just the blocking potential.
I mean, it's all of these factors. When you take a woman who's overweight and she loses weight, a lot of times she'll resume ovulation, and therefore she can get pregnant.
Which will be interesting to see if that becomes part of the protocol for women who are trying to get pregnant.
We'll stay on top of it.
All right. Thank you, Jen.
I told you Jen was the perfect one to be here for this.
Always good to be with you guys.
Such a pleasure.
Thank you, Jen. And before we say goodbye, we do want to mention Jen's free newsletter all about women's health. This week's newsletter includes a section whether medications used for weight loss may be used in preventing weight gain as we age. This is a new thing for Jen. You can sign up, join Agenda.
With a J-E-N. See what I did there?
I did.
And it's free.
Agenda.
It's free and it's fun, and it's just a little more insight and perspective on health topics that a lot of women care about: weight management and perimenopause and menopause.
You're bringing the topics that no one ever wants to talk about.
There you
to
go.
the forefront,
so I'm
and we love
excited.
it.
Thank
and the
you,
name
guys.
is better than Elizda.
Or a David Duh.
Or David Duh. Although we should run that. I don't know. I might have legs. All right. Thank you, Jen.
You guys.